On Saturday, September 28, 2024, Gift Health Plus Incorporated flagged off its Maternal Health Project in Mbaise at Ezuruezu Hall in Aboh Mbaise local government premises, Aboh Mbaise, Imo State. The event had relevant government bodies, both state and federal, private healthcare practitioners, civil society organizations, the clergy, major stakeholders and personalities of Mbaise in attendance, and of course, the primary target, pregnant women and nursing mothers who came in their great numbers from different communities in Mbaise. The Maternal Health Project, according to Gift Health Plus, GHP for short, through the Executive Director, Dr. Chamberlain Ugochukwu Nwanne, PhD, is a targeted intervention designed to combat pressing maternal and infant health challenges in Mbaise and Nigeria as a whole. Further inquiry from GHP Executive Summary stated, and I read, with Nigeria's maternal mortality rate alarmingly high at 512 persons per 100,000 live births, coupled with the widespread nutritional deficiencies among pregnant women, the project aims to tackle these issues head-on by distributing multiple micronutrient prenatal vitamins to pregnant women and nursing mothers in Mbaise free of charge to improve both maternal and infant health outcomes. The vitamins are formulated in line with United Nations guidelines and manufactured in the United States and were generously donated to Gift Health Plus by MAP International. Gift Health Plus has therefore received approval from the National Agency for Food and Drugs Administration and Control, NAFDAC, for the importation of these vitamins into Nigeria. The distribution phase starts from October 1st, 2024 in Mbaise, utilizing local health centers as distribution points or hubs. The project is a collaborative effort of Gift Health Plus, Imo State Ministry of Health, National Human Rights Commission, NHRC, local government authorities, healthcare professionals, traditional rulers, the clergy, and other key stakeholders. End of quote. Among the personalities present at the event were the number one citizen of Mbaise, the President General of Ezuruezu Mbaise, Sir Surveyor Joe Anosike, Eze Barrister Stephen Obinna Azubine, Obizie the 5th of Obizi, the Chairman, Nigeria Medical Association, Imo State Chapter, Dr. Bartholomew Uzodinma Echeta, Dr. Shah Azu Okorie, the Medical Coordinator for the project, Lady Justina Ngozi Okeke, the Imo State Coordinator, representing the Executive Secretary, National Human Rights Commission, Chief Tony Ojukwu San, Very Reverend Father Augustine Amadi, representing the Bishop of Ayara Diocese, Most Reverend Dr. Simeon Okeze Nwobi, Reverend Canon Dr. Ugo Romanus Nwogu, representing Right Reverend Bishop Chamberlain Ogunedo of the Anglican Diocese of Mbaise, Mrs. Immaculata Chukwuemeka, representing the Executive Secretary, Imo State Primary Healthcare Development Agency, Reverend Sister Dr. Joanne Uzoma, Mr. Chinedu Ongumedo, representing Dr. Uchenna Emelike, the Executive Secretary, CEO, Imo State Health Insurance Agency. Notable Mbaise personalities like multiple Chief Kelechi Onyebule, who came from the United States in solidarity towards the great initiative and to support a brother. And the last but not the least, the chief host himself, Dr. Chamberlain Nwanne, PhD, Executive Director, Gift Health Plus Incorporated, and the second president of Mbaise USA, who is said to have been a major part of the Mbaise USA Medical Mission Initiative. Onyonyo Mbaise was on ground to witness and capture the event for Onward reportage. Enjoy the highlights.
Ready for action, ready for environment, ready to share. And the sharing is why you all are here to know. And I say you are all blessed in Jesus' name. Maazị Kelechi Onyebule. Kelechi Onyebule so na ndị gbara mbọ ime ka ha anyị na-ega taa dịrị mfe all the way from the Texas of America. Because of all yes. Onye nke ọzọ nọ nke ahụ nwanne anyị nwoke onye wụ number 1 citizen of Mbaise as of today. The President General of Ezuruezu Mbaise, Chief Sorel Sir Joe Omoran Shiketiko Kelechi Mbaise. Dr. Shia Adokoproye. Now we have had all the medical certificates for this program today. Now we need to have we must have this of help the man to all Dr. Shia. People of Korea. The Anglican Bishop of Mbaise Diocese, Most Reverend Chamberlain Ugochukwu Nwanne, represented by Reverend Canon Ugo Romans Ikonokoreaka.
Come and take absolute control of what we have started today. May everything be to your greater glory of your name. May we receive blessings and protections. Whatever we are going to do today as we are in end of this assembly, cover us with your precious blood. And let that precious blood take absolute control of whatever we are going to do by the authority of God the Father, Son, and the Holy Ghost. Through Christ our Lord.
In my opening remarks to this occasion, it's just very brief. My opening remarks shows the thanks to our brother, Dr. Chamberlain, and the Gift Rector Incorporated for initiating this Maternal Health Project, which has brought us here today. I am the medical director of a hospital here in Mbaise, and I'm in the rural branches. I know the volume of anemia, the volume of malnutrition we now see in our pregnant women. Most women will come to hospital with a HB of less than 40%. Someone who is going to deliver the next 2 weeks, the blood percentage is less than 40. And whenever they have any form of bleeding, you see that's most of the time. So what we have done today, by bringing these supplements, for us to give the pregnant women to boost their blood, we have gone a very long way in reducing maternal and infant deaths in this state.
Let me start on all existing protocols. My brother, Chamberlain, Dr. Chamberlain Nwanne, for Aboh Mbaise program. I was hired in Rubia for long. Rubia is not about for that's no chicken. Take care, men of the lives of the wine, from wine, yellow man, That was why they, talk about different types. The medical problem. God.
Because suppose they can get some and after later say only our Dr. Chamberlain Ugochukwu Nwanne last year that I can show one for Umeriba. This is
Chief Doctor Chamberlain Ugochukwu Nwanne, Dr. Secretariat, Chief Mbaise LGA. I wanted to acknowledge Chief Doctor Nwanne. This is not his first initiative. Mbaise USA medical mission, also an every
Oh yes, people. This your journey, and I'm very good. I'm the existing protocol. Whether they want to be in the lab, I see from National Human Rights Commission. Oh well. Who is unavoidably absent, but heavily represented, man of his side, not him. Dr. Chamberlain Ugochukwu Nwanne, we are into partnership. We are collaborating.
How is actually the open communication on both you? I'm representing my grants or two children in the UK. The service secretary was taken to translate. In encourage our mothers. This thing is not a child spirit. Like I work with health insurance agencies. Most of you know some of my OICs that are here at the they can testify to that. We have recorded more than 2,000 free child births in Imo State. Even through translation, normal delivery. So I'm very much happy. Even at Onyonyo Mbaise LGA. So I will encourage all the mothers in communicate. But you know what we do?
I'm very happy. And then when we went to our daddy, Dr. Chamberlain Nwanne, ndị nne n'ebe a, unu ga-achọ ya n'egwu egwu a. Dr. Chamberlain Ugochukwu Nwanne, onye Chimereze na mmata ohe na ya. Onye Chimereze na mmata ohe na ya. I know that this initiative will go a long way in reducing pregnancy complications. It will go a long way to improve the health of pregnant mothers. It will go a long way to increase giving birth to healthy children.
Let me speak from the perspective of a medical practitioner. Those who take care of these pregnant women. So I'm speaking from experience and experiences, you know, taking care of these women. I am supplements, what is very, very important, especially within the fourth trimester. Folic acid helps so much in the implementation of the child. Antenatal care are a very known thing. One can go to 3 years, 4 years. You go over a problem. But this time around, you see that no matter what, they are very, very sharp. All because of the time they are modern people, all brain development. So it's very, very important. And also, for the mother herself, so supplement. When you are supplementing, or to add up, so give it you supplement with the drugs, so that everyone's in learning of her body after ending, or how we look at this and so how you have to see when you get to no
Chamberlain Ugochukwu Nwanne, Onyonyo Mbaise Onyonyo Nwanne, I didn't graduate America. However, I'm from Nala, so I am born and bred in Nigeria. Even though we lived in the United States for decades now, Uche and Obi and unknown still stays around himself, Nigeria. And that is why each time I come home and see the level of need, the level of sometimes I'm lost for words on how to describe what is going on. When I know that if I see Akawa in America, what's the way in America? What's a little easier over there? There is no reason why you say I got home and let out more power, or okay, go to the walk hospital, education. There is no reason, because Ubi said, Mutoromo, he must say, Mutoromo. And so, a few years ago, Onyonyo decided to form this organization, Help. And the goal was to help vulnerable populations in Nigeria. And vulnerable populations and include, obviously, our local women. When we go a amount of work, we have a basic ministry under the government. In fact, in collaboration with my colleagues from the National Congress, Chief Onyonyo Ugochukwu, a fantastic brother and a good partner. My organization provides supplementary health care to all the prisons in Nigeria. These are people on the prison. Some of them are activated and they know from state, letting you know within their criminals. But not all of them are criminals. But that is to tell you the extent of my commitment in trying to help vulnerable populations. However, for this program, our catchment area was women, rural women, and so we reached out to this organization, MAC International, that based in Atlanta, Georgia. MAC connected us to another organization that works with United Nations. And so they said, Chamberlain, how can we help? And I said, I need these multi-nutrient supplements for our people. Because just like our medical doctors care, the standard antenatal regimen care for folic acid and iron. But we know what we did in America. We know what we did in London. Their supplements are fortified. So why can't our women not get that? And so they said, okay, we're going to give you a full supply, but we'll do a pilot scheme. And they provided me with thousands of these bottles. So I went to NAFDAC. I went to authorities in NAFDAC and said, because we have one, you cannot just through law, but I do Nigeria without necessary authorizations. So I went to NAFDAC and graciously, they gave us the approval. They and gave us the approval to bring these things in. And that's why you see that. There's more Eboshi. This is a final scheme. But I said, you charity begins at home. Onyonyo Mbaise. Therefore, that is not to say it stops here. And like my esteemed doctor said, always good thing to partner with the state. And I'm sure both Commissioner of Commissioner of Secondary and our chairman and Nigerian Medical Association also said, the government has bought into this. And also, yes, our primary health care, every represented here. The government has bought into this program. It's just for us to sit down and harmonize the process so that this time around, I don't know why we did this, but we want to expand it to other areas of the Imo State and even Nigeria.
On behalf of the breastfeeding mothers, we thank you for providing this medicine for us. We thank you so much. We pray that may the Lord Almighty provide for you, promise you in the mighty name of Jesus.
Hello? No radio. People, follow government, even if you can be organized with that, and the one man, you did that, people, now.
Marachi how money nwere agba Ọnịcha. Ana m ekele onye wetara ọgwụ a ịhụdatị na ahụ dị ụmụ nwaanyị ike kpachate ndị dị ime ịhụdatị na ọgwụ a wee dị na ha mmụọ sọsesịrị. Ana m ekele ya na-asị ya dịrị ya na mma Chineke mepere ụzọ ebe ọ bụla o si weta ya akọrọ ya.
Ahụ mmadụ Joy onye Aboh Mbaise ezigbo bido mụta taa maka ahụbeghị m ụdị a mbụ. Mgbe anyị na-ekele Chineke onye nyere nwoke a amamihe iji kpọkọta ya ebe a taa mere anyị ụdịka ihe dị taa. A na-asị Chineke nyere ya amamihe a ya gọzie.
My name is Very Reverend Father Augustine Amadi. I am here on behalf of our Bishop, Most Reverend Dr. Simeon Nwodi of Ahịara Diocese. From what I have observed this morning is something commendable to help women. By the time you are able to take care of women, I think you are taking care of the whole society.
My name is Mrs. Chukwemeka Immaculata from Imo State Primary Healthcare Development Agency. I'm here today to represent our Executive Secretary, Reverend Sister Dr. Maria Yohanes Uzoma, who is unavoidably absent. So I am very happy with what happened here today. For our brother Dr. Chamberlain Nwanne to bring this type of supplement to the pregnant mothers and lactating mothers, I am very happy because I know that this initiative will go a long way to reduce maternal mortality, morbidity, infant mortality, and morbidity. So I'm very happy, and I say may God continue to bless him and his family. Thank you.
My name is Mr. Chinedu Owemodo. I came from Imo State Health Agency. I presented my boss, Dr. Onyonyo Mbaise, the Executive Secretary, CEO of the agency. Honestly, today is a wonderful day. It's one of its kind. This initiative is something I encourage our people to be doing. You know, this is the best empowerment, if you ask me. Giving, because in society, if our health is jeopardized, it will affect society. But when everybody is healthy, the development of the society will be healthy.
Yeah, you're welcome. I am Chief Honorable Dr. Shia Azu Okorie, the medical coordinator of the event that is taking place today. You know, in Nigeria now, there's a lot of poverty. Many people cannot afford one round meal, not to talk of 3 square meals. A lot of women, like I am in the medical practice, I'm the medical director of St. Joseph Hospital in Enugu. We in the rural area now, in the rural practice now, are seeing a lot of malnutrition among pregnant women, malnutrition among children. In fact, Tashoko has come back. So this event today, which is just distribution of these prenatal capsules to pregnant women, is a very welcome and commendable development. Because even though you may eat well and feed well, most of the time, particularly in pregnant women, they need little supplementation of the vitamins or the mineral they need for their own healthy development and development of the baby in their womb.
My name is Kelechi Onyebule. I'm from Obenishin, Ezuruezu Mbaise. I live in New Jersey, USA, and I'm here today to witness the initiative of Gift Health Plus. The Executive Director of Gift Health Plus, Chief Dr. Chamberlain Nwanne, we live in the same state in New Jersey, and above all, he's my personal friend. I came to support his initiative where he has invited pregnant women and nursing mothers in Mbaise, the entire Mbaise, to give them some medications free of charge. And I want us to record that Dr. Chamberlain Nwanne has been an inspiration when it comes to health. As a former president of Mbaise USA, he was one of those who initiated the Mbaise USA Medical Mission. giving free medical attention to all Mbaise people yearly.
My name is Chamberlain Ugochukwu Nwanne. I'm Onyonyo Mbaise Mbaise in the Ezuruezu local government area of Mbaise. And in fact, I am overcome with joy and gratitude for the outpouring of appreciation and support that I saw here today. This program, this Mbaise Maternal Health Program, turned out to be far more successful than I ever hoped for. And I'm deeply grateful to God and to my family and to those my friends and colleagues who supported me in this program. Like I said earlier, this initiative is for women in Mbaise. We are providing 6 months supply of these prenatal vitamins to all women in Mbaise, and we estimate that we will reach 5,000 women in Mbaise. We are hoping that that number would make a dent in Mbaise by providing them with these micronutrient supplements, not just the folic acid and iron that they normally get during their antenatal, but get the full spectrum of these vitamins as recommended by World Health Organization. Their rep was here today, and he fully supports what we're doing, just like the state government fully supports what we're doing. And one of the things that I was really appreciative of today is that we got a total buy-in from the stakeholders in Mbaise. Ezuruezu Mbaise was here, Mbaise Chamber of Commerce, and there's the PGs of the autonomous communities. They were here, and you can see that people are happy. And when our rural folks, when our vulnerable population, when our poor are happy, I am happy. That's the essence of what I'm trying to do. This is not about money. This is not about blowing my own horns. But this is truly me being at peace with who I am. And this is me being happy with myself. Because I think this is my calling. And I'm glad and I'm grateful to God that I have found what it is. And that is sinking my resources, providing my back, so to say, to help our downtrodden and to help the vulnerable ones in our population. And one thing I should ask the women who were all here today, hundreds and hundreds of them, and I know this is going to reach thousands more, is to be conscientious in taking these medications, because this is good medication. This is what's obtainable in the advanced countries, and they deserve the best, just like those other places. Unfortunately, they are not able to afford this, and that's where we stepped in to do this. And I implore the state government to partner with us and do a little more. This is almost like a pilot scheme we are doing in Mbaise today, but we can expand this to other local government areas in Imo State or even in Nigeria. You know, so that these ladies and these women all over the place have a more equitable and better life. Ekuchalam ihe m na-ekwu, and ndị asụrụ m na bekee incidentally, hama just to reiterate ka m kwukwa ya ọzọ n'Igbo, ọgwụ enyewe unu wụ ọgwụ shi United States approved under the guidelines of United Nations. All ezigbo ọgwụ, and ihe m na-arịọ unu biko otu esiri unu ọgwụ a 1 tablet a day, onye ọbụla ṅụọ nke ya ụtụtụ were otu lee n'ọnụ gị, ọ ga-emema gị ahụ, mema ọnwụ egwu n'afọ ahụ. Ọ bụrụ ndị nyewe ụmụntakịrị ara, ọ ga-emema ha ahụ. 1 tablet every day, ọ dị very very important. Ịṅụọ ya otu ahụ, ihe anyị nyere unu bụ 6 months supply, so ị ga-aṅụgide ọgwụ enyere unu for 6 months, 1 tablet every day. Ọgwụkwa, go to your health center, I get replenish here for you, I get your also. But because all the very important that
it was a very impactful and resourceful event, given the quality of speakers. The women and guests were well taken care of, as quality refreshment was provided, as well as transport vehicles which took the women to and fro the event. Others who didn't have transport vehicles allocated to them were given stipends as transport fare. From the stable of Onyonyo Mbaise, we want to specially thank Dr. Chamberlain Nwanne and his wife, Gift Health Plus, and other partners for this great and most needed intervention to reduce maternal and infant mortality rates and improve birth outcomes. We shall follow up with the distribution exercise across the various designated health centers in Mbaise, which started from October 1st. Yagazie.